Okay, so thanks everyone for joining us. It's kind of a bit of a special session of What's in Your Sandwich. We run these sessions every month, but we're going to change the format a little bit today just to do a presentation, just to give you some information on our Innovation Seed funding, and we'll have some Q&A. We won't do breakout rooms today, just do Q&A with the group that's here. So just to give you a bit of background, so in 2021, with the support of the Children's Health Foundation, CHI Research went out with their first seed funding grant programme. And then last year, we were really excited to be able to add an innovation award to the call. We really didn't know what kind of response we'd have. It was a bit untested for us, but we were really thrilled that we got 11 applications. And of those, 8 were shortlisted and 4 were awarded. So we're very grateful to the support of the Children's Health Foundation for these awards. I won't go into massive detail on these. Maura is very familiar with these 4 projects because she has been supporting them this year. So we have Sharon, who's developing a device to support children and young people with cystic fibrosis in taking their medication and monitoring how they're taking their medication. So really important life-saving medication for them, and a really great project. Dr. Aideen Byrne is working with the Cross City Allergy team, and they're developing a package of resources for young people with food allergies. We think potentially webinars, potentially videos, but they're consulting with young people at the moment, so we'll see what comes out of that consultation. Then Noelle and Shirley are developing an electronic form for referrals into the National Paediatric Craniofacial Centre. And Wesley is, last but by no means least, Wesley is our 22q11 deletion syndrome coordinator. And he is working with children and young people, developing using co-production principles, like working very closely with them in terms of what they need to develop information resources for them. And actually Wesley is going to be coming to our next What's in Our Sandwich in June, and he's going to present at that, because he's done a lovely piece of work with children and young people, just to understand what their challenges and needs are currently. So we thought we'd share that with people who might be interested in that. So we'll send some information out on that. So that's just to give you a flavour of the projects that were awarded last year. This year, again, we're going out alongside our colleagues in research. Again, awards up to 25,000 are going to be awarded. We are hoping to support more than 4 projects this year, potentially 5 projects. And just to give you a sense of the timelines, so the call is currently open. It'll be open until the 9th of June. So that's an important date to note. We'll be closing applications on the 9th of June. So it's just 2 weeks away now. And then after the 9th of June, there'll be about a 1-week period of kind of a grace period where we may go back to applicants if we need clarification, or there's typos or something in their application form that we need clarification on. And then we will review applications for eligibility, and they'll be put forward to our Innovation Review Panel. So our Innovation Review Panel were formed last year, and they are made up with members of senior managers from CHI, and also some people from our CHI Innovation Network. So, for example, we have a founder of a healthcare startup, representative from the HSE Spark Innovation team. So it's quite a well-rounded panel. And then after we put the decision forward to the Corporate Steering Committee for endorsement, we'll be letting successful applicants know, and all applicants know at that point. So we're hoping that will be end of August, early September. So that's just to give you a sense of the timelines. We're very much tied into research on that, so we'll be working along their timelines as well. So what do we mean by innovation? Just to go back to basics. So if you're sitting there thinking, well, I'm not sure if my idea is eligible, really we have a broad definition for what we see as innovation in CHI. We see it as any new idea that can be implemented to solve a healthcare problem or to meet a healthcare need. So it's very broad. It can include things like AI technology, but not necessarily it literally is anything that can meet a healthcare need. For us, there's important characteristics to that. We're looking for new or novel ideas. For us, it's really important that whatever your idea or your end solution is, that you're talking to whoever the end user idea is, you're involving them in some way. So usually it's patients, parents, or staff will be the end user of an innovation project. So how will you involve them? How will you understand if what you're designing is meeting their needs? There needs to be potential for your idea to be practically implemented within a healthcare setting, and really importantly, we're looking for impact, that it's not just innovation for innovation's sake, or a new piece of tech or a new app or software, that it's something that's really going to have impact for children, their families, or healthcare staff. So really, when we're looking at innovation, it could be a new product, a new service, a new process. So we're not tied to one particular definition. It can be any of these things. So just very going back to basics on how to apply. So the very first thing that's really important, if you haven't done it already, is to read the Innovation Seed Funding Guidelines, and we can circulate those after this call if you haven't got them already. So that gives the detail of how to apply and the criteria for awards. So it's really important that you have a good look at that, because that will give you the detail, and I'll summarise some of it here in the remaining slides. So this year, for the first time, we are accepting applications online. So we're delighted to be working with the National Children's Research Centre. Some of you will be familiar with NCRC. So they've been leading out in children's research nationally for many, many years. They have a physical building and physical location in Crumlin Hospital. And they will be coming into as part of CHI. So we're working very closely with NCRC around our research and innovation grants. And they have enormous expertise and knowledge around grants, what kind of grants are available, and how to manage grants. So we're delighted to be working with them this year. And I think, is Carl on the call? I think Carl was going to join us from NCRC if anybody has any questions about the particular software. So so the first thing you need to do is you need to register for an account on NCRC Grant Tracker. The link for that is on the guidelines. And then it's a very intuitive piece of software. There's a couple of sections you'll be led through. I'll talk a little bit about what we're looking for in a moment. So it's really important that you complete all the applicable sections. And we're also looking for you to get sign off from your line manager, just in terms of governance, just so that they're aware that you've applied for a project. And then, similar to last year, and we're continuing it, we're asking each applicant if they could submit a short video. So really what we're looking for is very simply you talking to your smartphone. There's a guideline video up there if you want to have a look at that. But it doesn't have to be fancy. We're not looking for graphics. We just want you to tell us a little bit about your project and why you're applying. And the reason we're asking for a video is really just because we find that the forms are a bit one-dimensional, and we love to see the people behind the application. So we started that last year and we found it really, really useful. So that's why we're looking for that. It doesn't have to be anything fancy or complicated, just you talking into your smartphone. So what are we looking for? So you'll be led through each of these sections when you go through your application form. But really what we're looking for is that you've identified something that needs to change or happen. So you've identified a problem, a healthcare problem or a healthcare need. And you have an idea that is new, original or novel. So it might be something that's already out there, but you're adding a little bit of a twist or an extra impact to it. So, it doesn't have to be brand new, but we would be looking to see what's original about your idea, what's a little bit different about your idea. It's really important that when you're applying that you can demonstrate that there's impact for children, young people, their families, and or healthcare staff. So we need to see that there's impact there. And actually, when we get the applications last year, that usually that's the best filled out section, because people really do consider that when they're applying. We really want to see, as I mentioned earlier, that there's a plan for how you'll involve stakeholders. So if you have an idea that involves children or young people, how will you really be sure that what you're thinking of meets their needs? So that's a really important factor for us. And so we're looking to see what your plan is to involve your end users. And that can be a section that tips your application application over the edge, actually, if you have a really good plan about how you want to talk to young people, children, or their families, or involve them as you go through your project. We need to see that your idea is practical, that it can be implemented. Crazy ideas are really welcome, but we just need to be able to see there's a line of sight for how it could be practically implemented within a healthcare setting. And also, we're really interested to see if there's potential for further development. So if you're proposing a project for one area, is there potential to spread to other areas? Is there potential to spread outside CHI, other healthcare, beyond healthcare? Any of those things we'd be really interested to see. I just want to talk a little bit about budget. Obviously, the awards are up to 25,000. Just to say, we will consider an application that's looking for more than that, but it'll be a case-by-case basis, and we'd really need to see a very strong return on investment. So if you're asking for more than that, we'd really need to see that the impact that you're expecting will match what you're looking for in terms of money, if that makes sense. Within your budget, when you apply, there's two main categories. There's project management and support costs and project running costs. So just to talk about the running costs to begin with. These are I won't go through everything, but this is what we've called out as eligible and non-eligible. So just to call out in particular, because we often get asked about it, staffing. So we can't pay a salary for new staff. We can't pay backfill or overtime for existing staff. What we can do is we can cover outsourced services. So for example, if you're running a workshop and you want to hire a facilitator, or you want to get design expertise that isn't available in-house, things like that we can cover, but not salaries. That's not possible. We can cover computer software and licenses, but just bear in mind that a lot of licenses need to be renewed annually. So it'll only cover you for the year that you're running the project. So just keep that in mind, because sometimes people get caught out in year 2 and year 3. If it's something that they need to sustain, they'll need to find funding for those licenses beyond the initial year. PPI stands for patient and public involvement. So if you think you might have costs involving to running workshops, potentially booking venues or giving people tea or coffee, things like that, we can cover that. And we can also cover small consumables, small equipment, and any costs if you need to produce something or disseminate something, we can cover that as well. So that's kind of the general, what we can cover, what we can't cover. But again, please have a look at the project guidelines for more information on that. Then just to talk a little bit about project management support costs. So as part of your application, we ask you to factor in cost relation to our innovation team resources. So we provide dedicated project support for up to 1 day a week for each project. So Maura Connell joined us last November, and Maura is our projects coordinator. And Maura, do you want to just tell us a little bit about how you currently support seed funding projects?
Yeah, so hi everybody. So as Anne said, I work closely with Anne and Barry as the Innovation Project Coordinator. So my job is really to assist the seed projects along their journey and design a project plan that will assist the project lead team to try and progress through the project in terms of the deliverables and timeline as best as they can, and that complements them with their workload as well, because it's very busy in a clinical hospital setting. And I'm there to offer guidance and support, any mentorship that I can offer, and really build a close relationship as well with each of the projects that we work with. So that's another thing, there's lots of support and guidance there. So the project teams can reach out to me at any point of the project.
Maura.
Yeah. No problem.
Great, sorry, Maura. Great, that's fantastic. Thank you. So so I think what we found is that the reason that we've put this role in place is because we found that money is great, but really what we're hearing from staff on the ground is they need this kind of support, just even somebody just to bounce ideas off, if they're hitting barriers, to help them remove those barriers. So that's worked quite well. We've had really positive feedback from our seed funding teams from last year on that. This year as well, we're hoping to also be able to provide access to an in-house designer. So we've been fortunate enough to get funding from the HSC, the National HSC Spark team, to provide us with a post that will be dedicated to CHI. Will also work nationally as part of the HSC Spark network, but CHI staff will have access to this designer. So this could be graphic design. It could be designing if you're designing a particular service, if you're designing an application or process. This person would be very expert in terms of how to design that up and can give support on that. So we'll be able to give access to that. Won't be applicable to every project, but some projects in particular will possibly have a requirement for that. And then also you'll have access to our innovation training. I'll talk a little bit about that in a moment. Myself and Barry and Maura have all provided a lot of mentoring to the 2022 seed funding awardees, just one-on-one meetings. We also bring all our current projects together for workshops where, just to tease out issues that people are having, and people are finding that very helpful from a kind of a learning and support perspective. And we also provide support materials to all the successful teams. So that's a little bit of what you'll be getting for that cost. So as each project is different in terms of its requirements, the advice is to contact us to talk through your project so that we can give you some advice on what we think the supports might be needed and what costs might be associated with that. And then the other general advice is just to make sure that your costs are eligible and within budget. Have a look at the application guidelines for that. Also, if it's helpful to confirm your budget costings with us, it's not necessary, but certainly talk to us in terms of your support costs, your general running costs. If you want to run them by us, we're happy to talk to you. We're happy to have a look at those for you as well. And then just general tips. Again, read the guidelines. We will be looking at quality of applications. So it's not to say that you need to really labour the application, but just make sure each section is filled in and considered. We'll be looking for value for money. So does the money you're looking for meet with the impact that you're expecting? We really, really can't emphasize enough. Do come and talk to us. We're available to meet in person, on the phone, through Teams, through Zoom, whatever suits you. And I'll let you know how you can do that in a moment. And also just to say, it's okay not to have a very defined solution. And when you're coming into an innovation project, we recognise that innovation projects are a little bit different because there is a bit of discovery that happens in the opening phases where you're talking to the people, children, families, and you might end up in a completely different space than you started. And we have built in a bit of flexibility there. And we get that. We understand that. So this is the innovation team. We have a general email address, chiinnovation@nchg.ie. Email us for any queries at all. We'd be happy to answer them. We also will be available. We run innovation ideas clinics all the time, actually, not just within the funding call period. We run them weekly across the sites. Our upcoming dates will be in Temple Street on Tuesday, Connolly on Wednesday, Crumlin on Tuesday. I will personally be in Herberton on Tuesday afternoon if anybody wants to talk to me. And Tala, we were just there last week. So, we don't have a scheduled day for Tala, but again, happy to come out and talk to anybody there if there's a requirement there. So I won't go into detail on this, but this is just to give you a sense of some of the training that's available. If you're not familiar, we run one-day design thinking training days. Next one's in June. It's fully subscribed, but we're going to be repeating in September and November, and we're also launching a longer applied skills program in autumn, which will be a series of workshops that will be stepped out to help people through projects. So that's the presentation, and we might end the recording there. Does anybody have any questions? I'll stop sharing here.